For many women who have breast cancer, radiation is a key component of the treatment plan in conjunction with surgery and chemotherapy. Anytime we're doing treatment, we're looking to both provide the benefit in terms of controlling the patient's cancer, but also looking to minimize side effects. In particular, for patients with left-sided breast cancers, protecting the heart from radiation is of paramount importance. One of these techniques that we can use to protect the heart is called deep inspiration breath hold. The idea being that when patients take a deep breath in, the diaphragm pulls down and the chest wall rises, and that actually pulls the heart out of the way of the radiation field. We are able to shape the radiation beams to minimize the radiation dose to the heart, but this is a technique that allows us to drive that dose even lower. Again, just by kind of physically moving the heart out of the way of the radiation beam by having the patient take that deep breath in. This is a technique that we incorporate into just standard radiation treatment planning sessions. Patients come into our dedicated CT room. Our technologists help them get set up on the table. And then what they'll do is they'll put a small plastic box on the patient's chest. And that box has a little reflector on it so the computer can watch the patient's chest wall rise and fall as they're breathing. The therapy staff will give them a few instructions about holding their breath. And then ultimately they'll set them up with a little monitor so they can watch their breathing as they go through. The video monitor is almost like a video game, so the patients can participate actively in making sure that their breath is where it needs to be. Once all the breathing practicing is done and we're ready to get going, we do just a quick CT scan with the patient holding their breath that we use for radiation treatment planning. Say the whole experience, maybe start to finish, takes us about 45 minutes. Once we've done that treatment planning, about a week later is when the actual treatments start, and we recapitulate that entire setup in the treatment room, so that way every time that the radiation machine is treating the patients, we know that their breath is in the exact same spot each time. Most patients do very well with this. You don't actually have to hold your breath for that long. We typically ask patients to try to hold their breath for about 20 seconds, but if they can't quite hit that mark, we can just pause the treatment and then pick back up. The computer will automatically kick off the radiation beam if the patient's breath falls out of that preset parameter.
And breathe.
This is a very important technology for us to have, and this allows patients to be able to pursue the most sophisticated type of radiation treatment for their breast cancer without having to leave the area.